Some of you may know that I'm heavily involved with SADAG, the South African Anxiety Depression Support Group. And one of the reasons why I do that is because it's all about mental health advocacy. And all of us as mental health professionals, we all know the word stigma, and we don't like the word stigma. And often I say to people, if, say, your pancreas isn't behaving itself and producing insulin, what do? You shoot up every day. Or if you have seizures, you take medication. But when you have a chemical problem, which we call anxiety or depression, somehow society tends to think, well, that's choice. Pull yourself together. Stop being ridiculous. Stop catastrophizing. And of course we know because we work like this. But it's very important to get this message out there that this is real. So please use those analogies because you may know it, I may know it, but pass them on to your client. That you wouldn't say to a diabetic, well, stop shooting up on insulin every day. You wouldn't say to somebody with epilepsy, stop taking those drugs and changing your brain chemicals. You would just be only too happy that these things were on offer. So if somebody's depressed or anxious, it's actually a chemical imbalance. It's genetic. This is proven. And so, yes, if you have a chemical imbalance, like with diabetes, you would take what you need to take. Now, there's quite an implication around stigma. So if we think about COVID, so COVID and mental illness and stigma are actually all in one family. So somebody who has a mental illness, anxiety, depression, often doesn't want to disclose because of all those horrible things that tend to happen. People look at them differently, they think they're weak, they're broken, things like that. And in the same way, people who might have COVID or who've got it or who've had it don't want to talk about it either. Because somehow this blame game starts. Well, you weren't cautious. You should have known. You should have sensitized or sanitized more. You should have this, that, and the other. Or who gave it to you? That's usually the first thing people ask. And in the same way, people are also worried that if they say, well, I think I've got some symptoms, people are going to shun them, move away, not want to support them. And so if you're anxious and depressed, you don't say anything because of fear of stigma, you don't get the treatment. If you've got the COVID symptoms, you also don't say anything. You then infect everybody else around you, and you might get really ill and seek treatment too late. So very important. Stigma is the enemy when it comes to mental illness, and certainly in the context of COVID. And just one extra little bit that I'd like to add. In Malcolm Gladwell's book, I think it was Blink, he mentioned something called the bystander effect. And this is a proven thing, which is that the more people there are who are witnessing something negative happen, an attack or a fight or something, the more people there are, the less likely it is that somebody's actually going to say something or do something or intervene or call for help. And this is another thing, that stigma makes us all bystanders. And so we don't really want that effect. So be the person who leads by example, especially if you're in a leadership role. And that's whether it's COVID stigma or mental illness stigma.